Hi, in this video I'm going to be talking about a chemotherapy port, what it is, why to have one, how to take care of it, and what to expect. A chemotherapy port is a reservoir attached to a tube that's placed under the skin, usually on your chest, and it can be put so it's not showing. For some people, if you have a lot of soft tissue in the area of your chest, you won't see it at all. You'll just see an incision that's usually less than 2 inches. If you are quite thin or bony, or your particular anatomy is such that you don't have a lot of soft tissue here, the port will be raised. Now it's under the skin, so it doesn't hang out of your body. The only time that we see the port or anything going into it is when you're actually getting treatment. So we will access the port through a needle that goes right into the reservoir itself. Why do we use a port? Well, a port can be really useful in giving you intravenous drugs if the veins in your arm are not good. If you have chronic medical condition that has made it so your veins are not good, or they're very small veins, or they roll a lot, or you've had treatment before, it's possible that your veins will not be accommodating an IV in your arm. We know across different healthcare systems that between 5 and 85% of people get a port for standard typical breast cancer chemotherapy. So there's a lot of variation, and that tells us this tends to be the personality of the health team that is associated with whether you get a port or not. I'm bringing this up because if you need a port and it's not something that's been offered, you can talk about this with your medical team. It may also be the case that your treating nurse will tell you, it's time for us to talk about a port. This is getting harder and harder for us to find a vein in you, and I'm feeling bad because it's so difficult. If you go to a place where it seems kind of automatic, you're going to get a port, you can ask, do I really need a port? It's one more surgery. It does leave an incision. That will be a permanent incision on your skin. The port will come out after treatment is over, but for a lot of people, they don't want another surgery. So this decision should be one that you make between yourself and your treating nurse. Your nurse will know better than your oncologist or other physician whether or not the port is right for you. Again, a port is put in under local anesthesia. It's done as an outpatient. If you are having the port put in the same day as you start chemotherapy, they can actually leave the needle in at the time they put the port in. We use X-ray guidance to help us, or under fluoroscopy, so that we know exactly where we're putting it. They can put the needle in right then, and you can go and get your chemotherapy right away. The port, like I said, under local anesthesia doesn't require that you go under general anesthesia. I recommend that you not go under general unless you need to. You can be given medications so that you don't remember having the port placed. After the port is put in, you'll want to take special care of the port. You have an incision and a foreign body, and we don't want to introduce bacteria or other organisms into a foreign body because it will attach to that. So keep the area dressed until the dressing can come off, and your medical team will tell you when it can come off. Don't use a swimming pool until it's healed, or a hot tub until it's all healed up. You don't want to shower and rinse off the dressing until it's time for it to come off. So you may just want to bathe or keep that area dry until it's completely ready and healed. When the port is accessed, as I mentioned, a special needle is put in, and the needle will come out at the end of your infusion. I do recommend a port for people who will be getting treatment for a full year. I have had some people who don't want a port and can go through a full year chemotherapy and targeted therapy without a port. So what kind of complications can we see with a port? It's a surgical procedure, so just like any procedure, there are risks. They are quite low, but they're important to know about. One of the risks, the most common one we see, is infection at the incision, the surgical incision. That one can usually be treated, that type of infection can be treated usually with topical antibiotics that we put right on the skin, and sometimes by other antibiotics by mouth or if it's more severe, by vein. There's also the possibility of having an infection where the catheter itself, the plastic part that goes from the port into the vein, so it goes tunneled under the skin, that can become infected. And that's much more severe if we can't treat that quickly with antibiotics. That may require removal of the port. We try to preserve the port and treat you with antibiotics, but it's important to be aware that if you are having problems in that area, it's important to let your medical team know. If the area around the port gets swollen and red and feels like there's fluid underneath, that's another reason to get attention right away. Another complication is getting a clot. Because it's a foreign body, the catheter that goes from the port into the vein can actually set up blood clots, because our body doesn't like foreign objects, and it can stimulate a thrombotic or clotting response. That may mean that we can still use the port, but we give what's sometimes called, its nickname is a clot buster. So we use something that will help dissolve the clot inside the tube so that we can use it. It's pretty uncommon for us to have to remove a port because of a clot. It does happen, but we can usually manage this with medication right in the treatment center. And that blood thinner doesn't go throughout your whole body. We put it into the port and then we take it out again. So, of course, a little bit will get into your body, but it's not enough that you are at risk of bleeding throughout your body. Other things that can happen is the port can become displaced. The tubing can get kinked or twisted, and that often requires that we go in through a vein in your body and straighten it out. We use a wire to straighten out the port and unkink it. Something very common is that the tubing of the port will go up against the blood vessel. So I'm going to show you with my hands what I mean. So if you imagine this is the blood vessel, the port, when we pull on it to access it and make sure blood is coming out, gets sucked up against the sidewall of the vein. So it's not actually blocked. It's just sort of, if you imagine suction, it's just sucked up against the side of the vein. And there are different positions we can have you take. We can have you put your arm up or move your arm around and try to get that port, the catheter, not to be right up against the vein. It doesn't actually hurt the vein, but it will make it so we can't pull blood from it, even though we can infuse fluid into it. And it's very important before we put anything into a port that we make sure we can draw blood from the port. In fact, having a port can be one way we can draw blood for you, so you don't have to get poked for blood draws like you would without a port. But if we can't draw back on it, we're not really comfortable putting something into it. We want to make sure it's in the right place. So that's when we use different positions to try to get the catheter away from the sidewall of the vein. I hope that's clear. It's kind of hard to describe with just words. So I've talked about a port, why you get one, who gets it, how it's done, what happens when you're done with treatment, that we take it out, complications from having a port. I hope this has been helpful to you. If it has, click like and subscribe. Drop a question or comment below. Let us know your experiences with ports. Are you happy you had one? Or are you wishing you hadn't? What did you wish you'd known before you had it? It's really helpful to other people watching this channel. And as always, you can go to yerbba.com to get your personalized report.